Hi everyone, Dr. Orit Hickman here from Pain Science Physical Therapy. I wanted to address a really quick question that patients will ask me all the time. Why am I feeling so weak? And why have other clinicians, other providers told me my muscles are weak? They might say things like, they notice that their muscles or their joints are uncoordinated. When they're walking up the stairs, they might find that they trip, might find that they drop things occasionally, might find their balance is not so great. And we have a really simple answer for this. When you've had pain for a period of time, your sensory system and your motor system are not communicating well together. So what does this mean? Your sensory system is your ability to feel where your body is in space. Touch, vibration, sharp versus dull, hot versus cold sensations. These are all sensory pieces of information, and they're pretty important to my ability to know where I am in space. When I lift my arm up overhead, there's a certain amount of stretching that I feel in my arm. There is a certain amount of pressure that I feel in the joints. Again, this is really important information from a sensory standpoint. When you've experienced pain for a period of time in a body part, or in multiple body parts, your sensory system is no longer communicating well with your motor system. Your motor system and your sensory system are super duper interconnected, and you need both of those systems working properly for you to be able to move through space. Or now when you go see a clinician who doesn't understand this concept, what they're gonna say is your muscles are weak. Muscles are weak. We need to strengthen your muscles. And maybe you do a lot of core strengthening exercises if you have low back pain, or you do a lot of glute exercises if you have lower SI joint pain or hip pain. Maybe you're doing a lot of chin tucks or a lot of deep neck flexion exercises if you have headaches and neck pain. And the problem is that if the issue is your sensory system's not working properly, and all anybody's doing is training your motor system, your pain's not going to get better, because that's not the root cause of the problem. And you want to find a physical therapist who is familiar with pain science, who can address this.